right, I am going to do the environmental scan. Okay. All right, I'm Amy Francie. I'm going to be doing my comprehensive video exam. Eric, do I have your permission to assess you and video record you?
Yes.
All right, so first thing I'm going to start out with is I'm going to look at his skin. I'm going to look at the moisture, temperature. I'm going to look for any lesions, any rashes, bruises, turgor. All right, next I'm going to look at his head and scalp. I'm going to look for any deformities, any asymmetry, any, again, lesions. I'll look for dryness, any flaking, and hair distribution. Next, I'll move on to his face. I'm going to look at his eyes, make sure that they look asymmetrically, that his eyelids look good. Look for any deformities on his face. Now we'll move on to the eye tests. So what I'm going to have you do is stand right here, cover one eye, and read me this line.
LPED,
Cover the other eye, read this line.
PECFD.
Perfect. You can sit back down. All right, then I'm going to do accommodation. Cover this eye, and then you have to look straight at me. Don't follow my finger, okay? Tell me what number I'm holding up.
2, 1, 1, 2,
All right, let's do the other eye. Did she see me? Yeah. Okay,
2, 1, 1, 1.
perfect. Then I'm going to do EOMs. So follow just your hand. Yep. Not your head. All right. I'm going to look in his eyes. I'm going to look for pupillary response. I'm going to first do direct, and then consensual. Keep your eyes open. Thank you. Good. Next, I'll look for the red reflex. All right. And move on to his ears. I'm going to look at his auricles. I'm going to look to make sure they're symmetric. There's no redness, swelling, drainage. I'll look at his canals. Look for the same thing: redness, swelling, drainage. And then I'm going to look at his tympanic membrane. I don't want to see it to be red or swollen. Good. Next, I'm going to move on to his nose. So I'm going to palpate the nares, and I'm going to feel for any deviation. I'm going to look inside his nostrils. Look for any redness, swelling, drainage. Good. And then I want you to open your mouth. I'm going to look at his lips, his tongue, his gums. Stick out your tongue. Good. Open up real wide. And then say ah. Looking at his tonsils, gag reflex. Then I am going to just feel his sinuses. Any tenderness?
No.
Okay. All right. Then I'm going to move on to his neck. I'm going to do neck range of motion first, so I want you to put your head down. Good. Put it back. All right. Normal. Then resist me. Press down on your, yep. Another one. Good. And then move your head back and forth. Perfect. Shrug your shoulders. Good. And then I'm going to assess for any asymmetry with his neck. I'm going to look for any masses. I'm going to feel for his carotid pulse, listen for any carotid bruits. I'm going to feel for his trachea as well. So I'm going to feel his pulses. I'm going to listen for any carotid bruits. I'm going to look for any jugular vein distension. I'm going to see if I see any pulsations anywhere. Then I'm going to move on to the lymph nodes. So I'm going to do preocular, sorry, posterior. posterior, occipital, tonsillar, submandibular, submental. Let me do superficial, posterior cervical, deep cervical, and then supraclavicular. Also gonna feel axillary. Good. All right. Actually, I'm just gonna do inguinal too right now. So, feeling for any swelling in those lymph nodes. All right, I'm going to move on to his lungs. So I think what I'll have you do first is I'm gonna have you come sit in the chair. Yep. And then this. I'm gonna have you lean forward. So first I'm going to percuss. Meanwhile, I am looking for any asymmetry with his chest and back. I'm going to look for the CVA, or no, I'm sorry, diaphragmatic excursion. So I'm going to percuss and listen for when I feel, like how far the difference is for the dullness. It's about that much, so about 4 centimeters, I would say. Then I'm going to have you lean forward. I'm going to percuss his chest. Any tenderness anywhere?
No.
All right, going to check fremitus. It's actually going to go perfect. All right, say 99.
99. 99.
All right. I'm going to listen to his lung sounds anteriorly. I'm listening for any wheezes, crackles, coarseness. I'm also looking at his chest rise and movement. I'm looking to make sure he doesn't look like he's in any distress. I'm going to make sure he's not using any accessory muscles. Turn again. All right, so I'm going to have you lean forward. I'm going to listen. Lung sounds here. All right, perfect. Next, I'm going to have you get up. We're going to go back slightly into the chair. I'm going to listen to his heart sounds. So I'm going to listen with both the bell and the diaphragm of my stethoscope. And I'm going to start with aortic, pulmonic, Erb's point, tricuspid, with the apex for the mitral. And I'm listening for any gallops, rubs, murmurs, making sure that I'm hearing S1, S2. I'm listening for if it's irregular or regular rhythm. Listen to the carotids, percuss the chest and chest straight. I think what else I need to do. I think I'm going to move on to the belly. Yeah, let's move on to the belly. Okay. I'm going to have you lay down. And then keep your knees like that. Perfect. All right, so going to move on to the belly. So first I'm going to look. I'm going to see if there's any asymmetry. I'm going to look for any masses. Just look for anything that looks not right. Then I'm going to auscultate. I'm going to auscultate all 4 quadrants. And I'm listening for bowel sounds. Usually you want to hear them within 3 to 5 seconds. I'm hearing his at like 3. Then I'm going to listen for the aorta. So So I'm going to do the aorta, the renal arteries, the iliac arteries. And then femoral. Good. Gonna listen by his liver. All right. Then I'm going to gently palpate. I'm gonna look for, let's see, I need to look for the aorta. So I'm gonna go above the belly button. Say probably about what, 2 centimeters there is the aorta. Then I'm going to do a deep palpation. I'm going to feel for both his kidneys and for his liver. I'm looking for, all right, make sure there's no enlargement. All right. Then I did the deep palpation. Aorta. I think that's it. Okay. I'm going to have you stand back up. You're going to sit back in the chair. All right, going to do his upper extremities. So what I'm going to look at, I'm going to look at his hands. I'm going to look, see if there's any clubbing, any cyanosis, anything odd with those. Nope. Then I'm going to have you squeeze. Perfect. I'm gonna have you do this. So I'm gonna look at his elbow. So, yep, and then out. And then resist against me. Resist against me. Good. And then give me your hands. Pull me towards you. Push me away. Good. All right, I'm gonna feel his pulses here. Good. I'm gonna do shoulder range of motion. Any pain with anything?
No.
All right. Go like this. Good. Hands above your head. Like this. And then behind you. Any pain with any of that?
No.
All right. Then I am going to move on to your hands. So we're going to do your wrists. I'm going to have you hold them out like this. And then resist against me, pushing them up. Good. Do that, pushing them down. Good. All right, open up your fingers. Squeeze them. All right. Keep them open. Don't let me close them. Don't let me close them. All right. Then I'm going to have you touch each thumb to each, or the thumb to each finger. Good. All right. I'm going to move on to spine. So I'm going to have you stand up. Okay, I'm going to do this. Let's put this up a little bit. All right. So I'm going to inspect his spine. I'm going to feel for any deformities. Make sure it's all linear. All right, and then I'm going to have you bend over. Good. And then stand back up and extend back. Like, sorry, you can't see me. Like this. All right, and then stand forward, facing the camera. All right, I want you to go to the side, the other side. Good. And then I'm going to have a twist. All right. You can sit back down. Okay, I'm going to look at, so I'm going to look at his legs. I'm going to look for any edema, any rashes, redness, swelling, any deformities with his knees, legs. I'm going to look at hair distribution. I'm going to have to put this down because she's not going to be able to see it. Okay. So, first I'm going to have you, let's see, put your legs out. All right, and then you can put them back down. Put them in, and then put them out again a little bit. Right here. Resist against me. Good. Resist against me. All right. Push up. Push up. All right. Resist. Push against me. All right. Good. Push down. push up. Push down, push up. Good. All right, I am going to have you lay on the floor. Knees bent. And on your back, sorry. Your workout. I'm going to do the tests. So, Ganesh patellas. Okay. All right. Okay. You can put them down. All right. I want you to move them out, leg to the side. Good, and back in. Out to the side for this one. And back in. Just relax. Any hip pain with that?
No.
All right, and then I am going to have you flip over onto your belly. And then I want you to lift up these thighs. Good. Alrighty, you can come back, stand back up. I'm going to do my femoral pulses. I don't remember if I did this or not. I'm doing it again. Popliteal.
I think we did.
Okay, posterior. Or post-hip, I'm sorry. Pedal. And then I'm going to have you put this foot up and then rotate all around. Good. Press down on my hand. Good. Toes to your nose. Good. Same thing with this one. Good. All right. Press down. Good. Toes to your nose. Good. Then I want you to take this heel and rub it along the shin, up and down. And then do it with the other side. All right. Good. Next I'm going to have you stand up. So you're going to come right here. I'm going to have you walk. So I'm assessing his gait, so just walk normal. I'm looking just to see how he's moving and if he's how his balance is. Then I'm going to have you come back to me, but I'm going to have you do heel to toe. Good. All right. And then you can come stand back here. All right. Put your legs or feet together. Close your eyes. All right, so I'm looking to see if he has any sway or movement, if he's not able to stand still. All right, you can open your eyes. You can stand normal. I'm going to have you hold out your hands and then close your eyes. So here I'm going to look for any pronator drift. Good. And then, actually, you know what? I got to do your elbows. You can sit back down. I need to look for his elbows, so I need you to do palms down and palms up. Good. All right. Next, I am going to move on to reflexes. So I'm going to start brachial. Brachioradialis. Okay. And then patellar. And then, see, Achilles. All right. Next one I'm going to have you do is I'm going to have you close your eyes. Touch this finger to your nose. Good. Touch that finger. And so that's for proprioception. All right. Then keep your eyes closed. You need to tell me where I'm touching you.
Arm. Arm. Arms. Knee. Leg. Legs. Knees. Leg.
What's that? Which one?
Right leg. Left leg. Both legs. Foot. Right foot. Both feet.
All right. Okay, then I'm going to have you close your eyes, hold out your hands. And then tell me what you think this is.
Apple.
All right. Keep your eyes closed. I'm going to hold up your hand. I want you to tell me what I'm drawing on you, okay?
Circle.
Okay.
7.
All right. Then do 2 points.
Oh.
Oh. Oh, it does that. It goes dark. Oh, are you serious? Okay, I think we're still good. Okay. Sorry, screen went dark. All right, close your eyes. Tell me when these feel like they're touching.
Yeah, touching.
Oh, I'm sorry. When it feels like it's only 1 point instead of 2. I apologize.
1.
All right, nice.
One.
All right. So next I'm gonna do sensory. So I need you to have your eyes closed and you tell me if it is soft or sharp, okay?
Soft. Sharp. Sharp. Soft. Soft. Sharp. Sharp. Soft. Soft. Sharp. Soft. Sharp.
And does it feel the same on both sides?
Yes.
Okay.
Soft. 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 Sharp. Soft. Sharp. Soft. Sharp. 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 Soft. 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 Sharp.
All right. You know what? I need to do the whisper test on you. Just like that. All right. So I'm gonna have you close this ear and tell me what I say.
Sunset.
Close this ear.
Baseball.
All right. I think that is it for my exam. Thank you. I